Hello, I'm Dr. Dennis McKenna, today by myself, giving you the update from Albany Medical Center. Today is Tuesday, June 15th. So no Fred today, as they say, he is on assignment. So I'll try to do this by myself today without my partner. Let's pop open the first graph here, Capital Region. There are currently 30 people in the hospitals of the Capital Region with COVID, and that number certainly continues to move down in the right direction. Next graph here is New York State. We show this one from time to time. You can see on this graph there's currently 617 people in New York State in hospital beds with COVID. That number at one point was as high as 18,800. And then the last graph for today is the morning census here at the medical center. So we're currently at 10. Of those, 4 are no longer infectious. So we really only have 6 people in the hospital that we're currently treating for COVID. Of those 10, 5 are on the floor, 5 are in the ICU, and 2 of them are on ventilators. And what's very interesting is over the last 7 days, 5 of those days, we've had no admissions for COVID. So clearly, numbers that we're all very excited about. Along those same lines, today, Governor Cuomo announced that we've hit a very important threshold in New York State. 70% of the population 18 or older has received at least 1 dose of vaccine. And so this is a moment now where he is instructed that many of the COVID-19 restrictions that were put in place will be lifted. This is obviously very encouraging news. What that means here on this campus obviously still has to go through the process of being evaluated. There are rule sets that we follow not only at the state level, but also by county or OSHA rule sets. Our team will take a look at that, but obviously we're very encouraged that these restrictions have been lifted because things are obviously moving in the right direction. Yesterday, in our midday update, there was also an announcement, given some of these improvement in the numbers that we've seen, that there are some changes to our clinical protocols here involving masks, including eye protection and PAPRs. I encourage you, if you missed that, to go back and look for yesterday's messenger, or you can find that information on our intranet page on the COVID-19 section of that page. Very important information in there put out by our epidemiology team. I'm very excited to announce that M4, one of our medical surgical units here, has received an award. And that award is the Teamwork Recognition Award. And that award was given out by the Northeastern New York Professional Nurses Organization. I think we have a picture of the team here. What's really exciting about this award is that the team was nominated by a pediatric nurse who had been redeployed to that unit during COVID. That pediatric nurse's name is Alyssa Laporte. So Alyssa, thank you so much for recognizing the nurses on M4. And congratulations to the nurse manager, Nanette Lorenzo, and the entire M4 team for receiving this award, Teamwork. It's really a great message, and the fact that they were nominated by someone who was not from that unit originally, I think speaks volumes about that team. And if you want to be a member of that team or any other team at Albany Medical Center, I encourage you to go to albanymedcareers.com. We've talked about this. It's about retaining, it's recruiting, and it's retaining. And our Capitalize Our Career campaign is in full swing. And if you're interested in being part of that great team, go to that website, please. Last thing today, I'm going to be followed by a video by Dr. Sophie Sakaris, who's one of the co-directors of our Surgical Intensive Care Unit. I've worked with Dr. Sakaris for many, many years in many roles. She's been president of our medical staff. She chairs many of the important committees at our medical center. She's an outstanding clinician and a great teacher as well, and someone who I consider very proudly to be a colleague of mine. And she's going to talk about Schwartz rounds, which are occurring tomorrow, and they occur on a regular basis here. And Schwartz rounds are something that is very important, I think, to the medical center, and I would encourage you, if you can, either to attend in person in Hike Auditorium, or if not, to remote in via web. We do incredible work here, but the work we do often has a toll on the people who work here. And Schwartz rounds is about creating a safe space for people to talk about the impact of what it means to be a healthcare provider today. And I know Dr. Sakaris will do a much better job than I have explaining the importance of it, but I wanted to use what time we have left in this video for her to explain that, and so we'll turn it over to Dr. Sakaris. We'll see you again later this week. Dr. Sakaris.
Good afternoon. I'm Dr. Sophia Sakaris, a surgical intensivist and physician champion for Schwartz rounds at the Albany Medical Center. Schwartz rounds are not like our daily bedside rounds. They are not involved in direct patient care and are not carried out at the bedside. Schwartz rounds are a multidisciplinary, interactive discussion held in a confidential and structured environment for all staff, both clinical and non-clinical. We come together to discuss challenging and emotional social issues that arise in providing patient care. Schwartz rounds do not come to any specific decision or conclusion. They are held in a private space. Only those who participate have access. They are held in a collaborative way to support each other and to learn from each other. Some of the topics that we have held with Schwartz rounds include the challenges of COVID. We've discussed the isolation of the caregiver, the fears of disease, the anger surrounding visitation restrictions, the daily deaths that we see. Another topic has been the patient you never forget. We all hold dear an individual who we cared for because of their unbelievable bravery, or their kindness, or the sadness that we share because we were unable to change the course of their disease. I invite you tomorrow, Wednesday, June 16th, from 12 to 1 o'clock in Hike Auditorium, or by remote WebEx to participate in Schwartz rounds. The topic for tomorrow will be being on the other side of the stethoscope. The challenges that we face as caregivers, being the patient or the family member of a patient in our healthcare system. Thank you very much for your time.